Hi, my name is Gabby. I'm going to be the massage therapy student for today. Today we're going to be doing some palpation videos. For the first muscle I'm going to palpate the brachioradialis. It's a muscle found in your forearm. The benefits of palpation is that it will help me determine the resting state of a muscle, and it'll tell me if there's any abnormalities or something like that. And then the risks of palpation is I could reproduce pain or discomfort if there is any abnormalities found within the muscle. So brachioradialis, the insertion is the supraepicondylar ridge. The insertion is the distal end of the radius. It's proximal to the styloid process. It is a weak forearm flexor, and the fibers run vertical, so they run up and down on the forearm. So I'm going to use my forearm as an example. So again, supraepicondylar ridge, right above the lateral epicondyle here, and then it runs distally to the distal end of the radius, but proximal to the styloid process, and that's found right about there. So those are going to be my two bony landmarks that I'm going to identify. Like I mentioned earlier, the fibers run up and down vertically like this. And how do you activate this muscle? So I have a weight here. This is what I'm going to use to palpate and to apply some resistance. You'll see that when I grab onto the weight that my brachioradialis actually pops up, and it's very easily to palpate. So I'm going to find my lateral epicondyle. I'm going to go proximal to it to find that supraepicondylar ridge right here. And I'm going to try to lift the weight up. My wrist has to be neutral for this. So it's a weak forearm flexor, but with this, your wrist has to be in neutral position. So not supination, not pronation. Again, I'm going to try to lift the weight off, and then I'm going to palpate. So cross fiber here, and then you can either use your thumb or your two fingers here. I like to use the two fingers. I feel like I have more grasp there. Okay, cross fiber palpation. Temperature is normal. There's no abnormalities there. Tenderness, yeah, I do have a little bit of tenderness in my brachioradialis. Just because I always write and overuse it. Again, just forgot to mention that with palpation, you can have the person contract and relax just for a bit of palpation. Texture, it's a little ropey. That's expected usually with tenderness. And there's a little bit of hypertonicity there. But nothing really abnormal. A lot of people have a tight brachioradialis or some tenderness there. Again, and then once I get to close to the insertion, it gets a little bit harder to palpate, so I'm just going to keep contracting and relaxing it so it just pops up into my hand so I can really feel it. And then again, my landmark distally is just above the styloid process, distal end of the radius there. Okay, and that is how you palpate the